Well, Dr. Zacharias, thanks for coming in today and talking with us about medical liability and what you call medical malpractice or MedMal 101. With a lot of the people that look at our podcasts and our videos are both providers and patients. So what message would you have? Let's first talk to the patients about medical malpractice and how it affects physicians and what you see as a CMO of Copic.
Yeah, great question. So, no patient goes into a care situation wanting to be harmed. And there is not a soul who practices healthcare who wants to harm a patient. Mm-hmm. And it's a shame that there is this, disconnect sometimes, mm-hmm. that somehow people who are providing care either were inattentive, causing the harm, or not sympathetic to the harm. Maybe 3.5% of hospitalizations have a major error. And those are gutting to the people who provide health care. And they're catastrophic to families, or they can be catastrophic to families and patients. And we have this system where when something bad happens, the people who provide health care, it's human nature. They're afraid to have the conversation about, gosh, I'm sympathetic. Here's what occurred. Here's where an error happened. Sometimes it's not an error. Sometimes in the course of really what we would call flawless care, still bad outcomes occur. But because of our litigious society, people are afraid to have that conversation with patients. And then patients, because they're sophisticated consumers of media, and they see, oh my gosh, these patients were harmed in this setting. They think, my gosh, well maybe these healthcare providers did harm me, and they're hiding something, and so then they seek an attorney. And so what I would love is when there are adverse outcomes, where in a very timely fashion, everybody involved in the healthcare is able to explain to the patient, here's what occurred. Here's where an error, if an error happened, here's where an error happened, and here's how we're going to correct it, and here's how we're going to make you whole in this process. And that communication, it just doesn't really exist in the modern healthcare environment. And I think it's not good for the patients, and it's not good for those of us who provide healthcare.
As healthcare has changed rapidly in the past decade or so, as we're getting to, I loved you called it the fast-paced portion of medicine, how we just seems to be lightning speed. How has the fact that reimbursements have declined for providers, the mounting costs of overhead for different providers has gone up, and that's caused kind of a rapid healthcare pace? How has that changed what you've seen the medical malpractice landscape look like?
Yeah, the challenge is most patients you can see incredibly quickly, and you won't miss that second finding, or you won't miss that subtle underlying issue which really brought them in that a longer workup might have delivered. And because there are pressures, as I say, it's practicing at the speed of clinical medicine, which is a lot faster in 2025 than it was in 1993 when I finished medical school. You go through patients quickly, and the early closure of, this person has some shortness of breath, they have a history of asthma, therefore this is an asthma exacerbation. You're usually correct until you're not. Yep. Until if you had a little bit more time to say, what else is going on in your history? I was just in Greece and I flew back 5 days ago on a 11-hour flight. And now you're thinking, now it's a PE. But if you're going super fast, there are just chances to not ask those extra questions, or there's pressure to not let the patient finish their thought process of why they really came in. Then they get frustrated. Gosh, the doctor rushed me. They must not be caring. And in your mind, you're thinking, I care tremendously. But I also have 9 other people in the waiting room who are incredibly frustrated because the last patient was also complicated, and now I'm trying to get through you quickly. And so it just is a challenge when you go super fast to see patients with as long of evaluation as you would like. And that's That's modern pressures, and it's a challenge.
As you've dealt with a lot of the cases that end up going to lawsuit, and kind of on that same note, what maybe recommendations to providers would you have to find that balance between making sure that you're on time with your schedules, but also asking those additional questions to find out more? What have you learned in your process?
The one thing, and no one ever believes this, I don't even believe it, but I've looked at the studies multiple times. If you let a patient tell their story, if you let them finish their thought process, even if you think it's going to go on for an hour, it averages about 17 seconds. Feels like an eternity. It's not. And then for the long talkers, it's 45 seconds to about a minute and a half. And 1 out of 200 people will talk for longer than 2 minutes. And so you have to trust that if you allow somebody to get their thoughts out, they will give you useful information. And you have to trust that if you don't jump in and interrupt people, you will get some information that could potentially be very helpful in the evaluation. And it just solidifies, that physician-patient relationship.
Yeah. Well, I think it's all good stuff to hear from for patients, and we're also for providers. For us, it's always daunting to hear these talks, to go, how much more can I do? But I think at the end of the day, it's really good to hear, because it's a reminder that at the end of the day, patients are scared. Providers are equally scared, because they don't want to miss anything, and they want to provide the best care possible. We appreciate your time, and thanks for coming and talking with us today. We appreciate it.
Yeah, thank you for having me.